So for neuromodulators, typically they're used to treat the upper face, and fillers are used for the mid and the low face. And again, they do different things. But for neuromodulators specifically, they can be used for forehead lines in your frontalis, your glabella, which is your frown complex, crow's feet. Those are the three main areas. There's also some other areas that are interesting for neuromodulators, such as if you've got a gummy smile, you can lower the lip a little bit so that you don't show so much gum in your smile. If you have downturned corners of your mouth, as we get older, by getting a little bit of neuromodulator, it can neutralize your smile, make you look more approachable. And then finally, for people that have dimpling in the chin, you can use neuromodulator there as well. For fillers, it's a little different. Fillers can be used mostly in the mid face and the low face. So kind of starting from top to bottom, the places I like to use fillers are one, the temples, which is where people start to get atrophy as they get older. The cheeks, most people could use some cheek augmentation, and that also can provide volume, contouring in the cheek, and also lift up the mid-face and provide structure to the mid-face. The nasolabial folds are a good target for filler, marionette lines, and of course I like to do chin and jaw augmentations to strengthen and contour the chin in males and to define it in females. So there is a medical condition called hyperhidrosis, which is excessive sweating, specifically under the armpits or in the axilla is one area where Botox can be used, or neuromodulators can be used. There's a treatment progression. You start off like anything with lifestyle measures. There's certain higher strength underarm medications and antiperspirants you can use. However, if it's a big problem for you, then yes, using neuromodulator or Botox in the armpit area can help eliminate excess sweating. So I think that fitness athletes are the perfect patient demographic for these kinds of treatments. So for neuromodulator specifically, if you think about it, you're going to the gym, you're working on your aesthetics, you're trying to make your body as symmetrical as possible and aesthetically pleasing as possible. However, you can't really treat your face in the gym, so you need to do something else for that. When you're in the gym and you're pushing hard, you're often straining and you're contracting those facial muscles. So that builds up the facial muscles, promotes hypercontraction. That will put more folds and wrinkles in your face. So by using neuromodulator treatments, you can relax those facial muscles, and that will prevent the development and erase some of the lines and wrinkles out of your face. For filler treatments, depending on people's facial shape, they can do a lot to help provide definition in the cheekbones, definition and strength in the and contouring in the jawline, and by reproportioning the chin, we can help balance the frontal facial proportions. So the downtime for the procedure is quite minimal. After the injection, usually you can go back to work and do your regular activities the next day. Of course, with any kind of injection, one of the risks is swelling and bruising. For the vast majority of people, it's quite minimal, it goes away. Every once in a while, it might take a little bit longer, but essentially there's no downtime for the procedures. So men are excellent candidates for neuromodulator and filler treatment. Typically, people never really talked about these treatments in the past, or it was mostly female patients. However, more and more men are opening up to the idea, and I'm really happy about that because these treatments are equally, if not more, effective in male patients. So men on average typically have stronger facial muscle structure than females, and so that lends itself to development of lines and wrinkles and all sorts of age-related changes. So by using neuromodulators in men, we're able to reverse some of those age-related changes and also prevent the development of these lines and wrinkles in the future. In terms of filler, so filler is also very useful in men. Typically we focus more on the lower face, so by doing things like strengthening the jawline, chiseling the jawline, improving chin proportions, but we can also use it to help add volume to the cheek that is lost, and by filling in nasolabial folds, those sorts of things. So men are great candidates for these procedures.